Hello and welcome to Health Matters on Channels Television. Thank you for being there. I am Mary Alale Yusuf. By the 6th week of 2020, there were over 1,700 suspected cases of Lassa fever, 472 confirmed cases in 26 states across 92 local government areas. Sadly, 70 people have died from this year's outbreak. From week 5 to 6, the number of confirmed cases increased. 35 of all confirmed cases are in Edo State, 33% in Ondo, and 6% in Ebonyi. 26% is shared between the other states. Most people affected are between 21 and 30 years old. 4 new healthcare workers were affected in Ondo, Delta, and Kaduna states in the 6th week of the current outbreak. My guest is a consultant public health physician at the Lagos University Teaching Hospital and senior lecturer at its College of Medicine, Dr. Ezekiel Oridota. You're welcome to the show, sir.
You're welcome.
We talk of a lower case fatality rate now, you know, this year as compared to last year. But 70 people dying is a lot, considering that we're still in the beginning of the year. So, it's just February. So, is it looking like we're going to have more cases than last year at this rate? Our dry season isn't over.
The way it's looking, we may. But I'm not surprised that we're having this type of problem because our way of life has changed.
Okay.
Many of the problems we are having, all the viral hemorrhagic fevers that we are having, including the Lassa fever, they are diseases that have respect for hygiene and sanitation.
Respect for hygiene.
Hygiene and sanitation.
Okay.
And many infections that can be contacted that are epidemic prone by washing hands alone. 80% of the problem, you can prevent it. So when you have a community, a group of people with poor hygiene, food hygiene is poor, food safety is poor. Let's look at the way the Lassa fever is being transmitted. Rats come into the home, have contact with food, people take the food, and then eat the food. So there are basic things that we need to do in terms of hygiene and sanitation. Apart from that, if you look at the way our cities develop, the cities develop faster than the development itself because you have people building houses in new places, no road, there are bushes around, there can be mosquitoes. So when you look at the environment, it's easier for many of these problems. Yeah, for interaction between these rodents and man. But the main thing, we really need to educate our people. We need to talk to them about this.
Apart from educating our people, we'll come back to that. But you see, we can see that there's an interaction between humans, the environment, and animals. Cases have been increasing every year. Isn't it about time that the professionals in these 3 areas came together and cooked up a sort of plan to drive these numbers down?
You mean professionals treating animals?
Animals.
And then human beings.
Human beings and people of the environment, so that there will be expert information on each sector and how to handle it.
Well, to
reduce this interaction.
Let me bring it to your notice. There is a forum for that interaction. Because of the problems that we are having nowadays, we realize that a lot of them are from animals. There is a name we call them zoonosis.
Yes.
And because of that, there's what we call One Health. It's been happening in Nigeria. There's interaction between veterinary doctors, Ministry of Agric, and the people in health. And they've also gone beyond what we are saying here. They are now thinking of including research aspect to it, and the meetings for containing or controlling epidemics, people from environments are there. People from the One Health brings in people from veterinary and all those people. So it's already happening. But the issue is beyond that. You may have the best experts in the world, but But you see, you need structures. One, we need structures on ground.
What do you mean by structures?
Our
Specifically?
structures need to be strengthened. I will mention some of them later. Our structures need to be strengthened. We need resources. Look at, you can't talk of people having problems that have to do with hygiene, problems that have to do with fecal-oral transmission. There's no water. If they don't have potable water, they don't have basic, when the structures are not there. So we need structure. The structure should not just be at the federal level or the state level or local government level. It should go even to the community. We need to involve the community. The community need to participate. And enlightenment program. You people in media talk of C4D, communication for development, things that will change their behavior. We need to start engaging in that. Because many of these cases, before they get to the health center, before the health people pick them up, even at that stage, at the local stage, the structure is still weak. Because there are so many local government that may not even have doctors. They don't even have, they require skills, the health manpower to deal with it. But let's even leave that level. Because when they get to a health facility and there is a screening criteria, they can be picked. But look at the community where it happens. The information flow. Many of them see TBA. They see village health workers. Is there surveillance at that level? So,
but is there surveillance at that level?
They are supposed to be. They're supposed to be. That is when the community, the people at the community, when they are empowered to take charge. And that's why many of these problems can be tackled at the community level.
Now, there's a disturbing trend which I see. Most of the people affected between the ages of 21 and 30, those are supposed to be our young people, our strong people. This is a disease for the immunosuppressed. So what's the explanation for this?
The Lassa fever, it doesn't really mean that it cannot affect adults. It affects pregnant women, it affects adults, it affects children. It does not really discriminate. But we know that many viral problems, for people with weakened immunity, at extreme of age, they may easily break down when they are exposed to so many antigens. Well, it can affect anybody. It can affect anybody.
Okay, so there's another trend we are seeing. Traditionally, this started in Borno State way back 1969. But now, if we look at the map that shows, which states were affected, it actually started from the South. It's like the South is owning it now. What are we doing wrong? If you look at the screen now, all those places with the preponderance of yellow dots, that's where we have the most cases. But this thing started from Borno before. So maybe they're doing something right up there that we should copy. What do you think is responsible for this? Or are we seeing another mutation?
It's not really another mutation. The Edo area, the Edo has the Delta as is known to be endemic.
Yes.
For Lassa fever. That's why there is a center, a specialist center close to that area that treats that problem. So it's not something new. We understand some of the epidemiology that is happening there. Around this time, it's dry season. People are preparing their bushes. People are burning the bushes. The rats are running away from that place, and they are coming to the environment. That's part of what is contributing to it. But the main thing, this is a disease, a problem that can be prevented if people can just keep their food safe from rats. So when we get it to the community, when we get it to the people, and the people at the community level, there are so many things people know about sanitation, but sometimes they don't want to do it. So we really, really need to tell our people that, look, there is no substitute for sanitation and hygiene. When you look at many problems that we are talking about, whether it's cholera, it's hygiene. Even the yellow fever transmitted through mosquitoes, if your environments are okay, mosquitoes will not be there. Yeah. But if you look at our parents, like I was somewhere on Sunday, and someone was talking about it, that in the 60s, she used to see some people, they would just get sick, and then before night, they are dead, and she was wondering what kind of problem. Many of those people at that time have experienced terrible problems, terrible epidemics. And there is one we call in Yoruba, Shopono. You know, it's become like a deity. And people, it was smallpox.
Oh,
And smallpox is gone. So some people even make it like a religion. Carry it, you know, they want to carry the dead person, and it was really a terrible thing then. But we were able to wipe it out. So people who saw smallpox, people who have experienced terrible epidemics, they won't play with hygiene. They won't play with environmental sanitation.
What was gotten rid of with a vaccine.
Yes.
So maybe what we need is a vaccine for a disease as pervasive as Lassa fever.
I agree with you. Vaccine has its own usefulness, but it cannot replace hygiene and sanitation. Let's say we have vaccine for Lassa. We don't even know which one will come, but hygiene and sanitation can control so many other things. Let's say a form of diarrhea now. You have vaccine for cholera. What about dysentery? What about this? So you now realize that looking at it from public health angle is counterproductive if we are not tackling the issue of hygiene and sanitation. Because when you look at it, the way we were brought up, it's like things have really changed. Those elderly people, the way they treat the water they take, they put it in a pot. They don't have the infrastructures that we have now. They don't have the education that we have now. They don't even take cup from outside into the pot. The way they do the hygiene, and I think we need to return back to it.
they are more careful.
They are more careful.
If you look at the screen now, you will see that there was an exercise some time ago in Lagos. Those are health officials putting poison out for the rats. Now here's what I'm thinking. These rats multiply so much. Shouldn't we do something like that once in a while for them? I mean, rats are not like human beings. A rat gives birth and you have 7 children all at once, 8 children all at once. Shouldn't we be looking in that direction too?
You see, you have a point there. What they are doing, it's right, it's good, it's part of the control measure. But you see, you know, the first thing I said was the community. It's like we are bringing it back to the authority.
Okay.
It should not really be.
But we should look at the people.
It should not really be that way. Because some of those issues can be tackled at that level. It will not really be a problem before it comes to the center, to the states, for the authority to start handling. Because at the community level, so many things can be handled.
Now, this is a really heartbreaking one. We had in week 6, I believe it's 4 health workers involved in Lassa fever. What are we doing wrong? Is it that we don't have enough protective equipment? Is it that we're in denial? Or we're just plain careless? What is going on? We don't have that many health workers to be disposing of any at all in the country.
Let me tell you something. Maybe something that may make you glad a bit. If someone have Lassa fever in this country and it gets to one of these designated government treatment center early,
okay,
is likely going to have very good prognosis. The people with poor prognosis are usually people who are picked late. Maybe they've started bleeding and go. Now, coming back to the question of the health workers. Health workers with standard precautions, which start with distance. And that's where the education comes in. You come to hospital, somebody is maintaining 1.5 meters, 1 meter, and is pointing the thermoscan to you, the infrared thermometer. And then when they put their questionnaire through and they say, okay, stay in one place, let's see, we need to investigate you further. People need to know in the hospital, all those things need to be there. But imagine, as a doctor, somebody comes to clinic in a general hospital. So the health workers are also being trained to have that high index of suspicion.
Okay, high index of suspicion. Let's come back to that in a second. Stay with us. We're going on a short break. Meet us at the other side. Welcome back. This is Health Matters, and we're talking about Lassa fever. If you have questions, the number to call is 0805-468-3514. That's 0805-468-3514. You can also tweet at CTV_Mary A. Shegun is asking on Twitter, I mean, talking about enlightenment. Is it all rats that cause Lassa fever, like it is Anopheles mosquitoes that cause malaria?
I will want to answer that question. There is a particular type of rat, but get rid of all rats from your home. They are rodents, so there is no usefulness for them. Just get rid of them.
Because they all carry some kind of thing, don't they?
So just know that for you, for the purpose of education, rat is rat.
Don't
but
be
the professionals
looking for the particular
know the
one.
kind of rats that cause the problem. So get rid of the rats.
Okay, you were painting a scenario about somebody comes into the hospital with a fever. You were talking about the prescribed distance from the health practitioner so that we can save our doctors.
You see, when client comes to the hospital, they come through different avenue. Some can, but the person that is really, really sick is going to come through the emergency.
Okay.
And some structures have been put in place to make sure that there is a form of screening, depending on how big, depending on how big the center is. If the center is quite big, they call it a bigger name. They call it a triage. A
triage, yes.
Where they can sieve cases and then they know what to do. That is one thing.
But even in that triage, they have to separate patients from patients.
You are coming back to issue of structures, which I talked about. We need to strengthen our structures.
So that's part of the structure.
That's why, yeah, we need to strengthen our structures. You can have the best of health workers, but you need to put the right environment also in place.
Take us through the symptoms of Lassa fever again.
What I will tell you is this. When a client presents with Lassa fever, it will just be like malaria.
Aha.
So it has fever, the person will have fever, the person will feel sick. But at the end of towards the end of the problem, that's where the person begins to have bleeding.
That's when you know it's something different.
Yeah, but at that stage, it's already becoming late.
Typically, somebody with a fever would first treat malaria. If that didn't work, they would treat typhoid fever. If that didn't work, then they would go to the hospital. Just a minute. Let's quickly take someone who is calling on the line. Hello. Hello? Okay, try again. I think we lost him. So tell us, if somebody has a fever, what steps should the person take from day one?
We have a screening, let me say, criteria. When we look at the fever, we look at the person have been treated with medication for malaria. And in Nigeria, malaria, typhoid, and co is not going. The person have had contact with somebody who has died of fever of unexplained origin, unknown origin. So we have those criteria that we have put in place.
But you see, this person who is coming to you has probably come on day 4 or 5 of his fever.
That is where the health workers are at risk.
Just a minute, let me just cut you short for a while. We're taking Agnes from Makurdi. Hello, Agnes. We lost Agnes, but Agnes, you can try again.
That's why the health workers are at risk.
Aha.
And
you come in day 4, day 5?
That's the reason why they've been trained now. They have been trained, especially I know about Lagos, that they have been trained, even at the local level, to be able to get those cases early if they visit their primary health care center. I know they've started the training where they can screen a particular client and then make sure they isolate the person and the right person they need to tell, to notify.
Let's take Wisdom from Canada. Hello, Wisdom.
Hi, good morning.
Good morning, Wisdom. What's your question?
My question is, I know you mentioned about vaccine. I think it's very important that we emphasize on that. Vaccine is very, very important to our system. We have malaria that is still killing people up till now.
Okay, thank you, Wisdom.
Well,
thank you, Wisdom. Wisdom feels that we should still look into a vaccine.
I agree with him.
Especially for such a disease,
Vaccine is important. especially for a system like ours. I agree with him. But it cannot replace hygiene.
We need to change.
Yes, it cannot replace hygiene and sanitation because there are several problems that hygiene and sanitation will handle. But that person will feel, okay, I'm safe. But there are other things that if you can wash your hand, if you can have good hygiene, if your environment is neat, so many other things can be taken care of, and then you can also have your vaccine. So vaccine is important, but we should not use it to replace environmental sanitation and hygiene.
Okay, so you've trained them to find out what really is the problem, to be on a high index of suspicion.
Yes.
When somebody comes in with a fever. It might not be malaria, but they check for malaria first, right?
It may not just go like that.
Okay.
Those are the tricky
Let's see if
things
we can get
for the health workers.
Abdullahi
Okay.
on the phone before we continue. Hello, Abdullahi.
Hello, madam. How are you doing? My name is Abdullahi, calling from Yobe.
You're welcome. What's your question?
Now, mine is a question and commendation. Hello? Hello?
Hello, we can hear you.
Good. Mine is a question and commendation to doctor. One is, this our community, especially Yobe and Borno, where we have a high number of IDP and displaced persons. Hello?
We can hear you, Abdullahi. Talking. From Yobe State. Okay. We were talking about systems, like you said.
Yeah. And then I think you
Wash
stopped
your
when
hands.
you're asking about malaria.
Yes.
When that's where the health workers, sometimes are at risk. And then there should be this high index of suspicion. Before you even touch, like you are saying, maybe they check for don't touch first.
Touch.
Before you touch with your turbo scan, the infrared thermometer, check the temperature. There is a screening criteria. There are some questions that you need to administer on the client to find out that does this person meet the suspected case criteria. And then if that person meets your suspected case criteria, you are not really expected to touch. What you just need to do is to just let the person stay somewhere, then call your DSNO or the local government authority. They know what to do. They can. And then if it's in Lagos State, there are ambulances that will carry such a person. There are things they will do. And people who are going to handle such patients, such clients, they know what to do. They will be properly
So
treated.
tell us, how long does it take to identify a positive case of Lassa fever from sample to result?
In the lab.
Yes.
If it's Lagos now, at my center, within a day you should get it.
Okay.
A few hours.
That's
within a day you
good.
should
But you
get
see,
it.
there's the problem. Maybe we need to have centers everywhere
We are
for
coming
a case
back
like
to
that.
systems and structures.
structure.
We need to strengthen our system. We need to strengthen our structures.
And on that note, we have to call it a wrap on the program. Thank you so much
You're
for
welcome.
coming to the show, and thank you for calling. All those who didn't get through, will get through some other time. Have a wonderful day. I am Mary Alale Yusuf.